just going to give you a quick backgrounder on why we are here. Just last year, as part of Budget 2012, the federal government announced that they were making changes to the interim federal health program, which provided refugees with health care in line with that provided to Canadians on social assistance. The changes came into effect last June, and under the new rules, refugees that arrive under different categories qualify for different health care. And through Bill C-31, Minister Jason Kenney released a list of countries he decided were safe countries and unlikely to produce refugees. So if you're a refugee sponsored by the government, you get the same health care you would have prior to the reforms. If you were a refugee sponsored by a private entity, you would get health care only if it's urgent or essential. And the same was true if you're a refugee claimant from a country that was not on the safe countries list. But if you're a refugee claimant from one of the countries that's on the safe countries list, you basically had access to virtually no health care at all. You'd only get access if your condition was a threat to public health or safety. This means that advanced colon cancer can leave you with a $32,000 bill, like it did Israel Sosa. Chronic retinal detachment could leave you with a $10,000 bill, like it did Garcia Rodriguez. Or chemotherapy for stage 4 cancer can leave you with a mortgage-sized debt. The obvious question is, why were these changes made? According to the minister, Canadians are getting a rotten deal from these refugees. Not only will these reforms save the hardworking taxpayer $20 million, that's 60 whole cents per Canadian, but these healthcare stealing refugees will no longer receive gold-plated healthcare, because he knows that refugees come to Canada not fleeing war and persecution, but really to fleece us of our generous healthcare.
Very funny.
So, thank you all for coming out today and protesting these reforms to the interim federal health program. Thank you for coming out and standing up for this. I'm going to introduce to you a local activist and poet from Edmonton, Ahmed. Where is Ahmed? Ahmed Nomadic, Ahmed Ali, and he will be taking us through today's event. So please, Ahmed.
Thank you very much, Adi. Welcome everybody, and I'm really glad that you guys would come here today to stand for something that you believe in, because if you don't stand for your neighbors now, who will stand for you later? So I would like to say thank you to the Aboriginals and First Nations that allowed us to be guests here, and to continue that, please help me welcome up to the stage Aboriginal leader and educator Louis Cardinal. Round of applause, please.
Brothers and sisters, our new relatives from across the way, I bring greetings from the Indigenous people of Edmonton and also Alberta. Being a First Nations treaty status person, I am also an upholder of that treaty. We have to recognize that Canada, or Canada, is a place, a sacred place, where our relationships are meant to be kept in order. Obviously, with this federal government, that is not a concept that has taken root. I also want to share with you the commitments our people have in standing together as peoples to support the injustice that is happening to all people here, especially in this day and age. Indigenous people in our health care is less than half. For every dollar that Canadians get for health care, Indigenous people get 50 cents. And that's only one disparity ratio. There are many more. So we do understand your pain. We will not stand by idly and allow this to happen to our brothers and sisters who have come here to share this kanata, to share the great wealth that we have. You are welcome here. You have come here with your families. You have come here to start new lives, and you've come here to maintain who you are. And that is what we stand for. And as the next potential federal NDP candidate in Edmonton Centre, that commitment carries on. I know my colleagues and friends in Ottawa are standing behind this and saying this will not stand. So let's work together. Let's work as a unified voice and tell our leaders and our elected leaders that we cannot allow this travesty to continue, that Canada belongs to us all. Strength to you, blessings, and safe travels. Hi, hi.
Buddy. It's nice to see a good turnout. I'd like to think that each of you is representing another 10 or 100 more people who share our concerns about this issue. So I'm here for several reasons. First of all, I look after people. Oh, this is for shorter. First of all, I look after people who are refugees, and it's certainly gotten more complicated since these cuts have occurred. As it happens, I've actually worked for a number of years in some of the countries which are major sources of refugees arriving in Edmonton, particularly South Sudan and Zimbabwe. So I feel I have a little more sense of what their experience has been and what they've been through. On a more personal note, my wife's parents were refugees from Canada to Canada after the Second World War. Yeah, that has a special resonance for me. But most of all, I'm here as a Canadian because as a Canadian citizen, I'm ashamed of these mean cuts that we've introduced. So Canada, as you all know, is a country of immigrants. According to the recent census, more than 20% of Canadians are foreign-born, and that's among the highest of any industrialized country in the world. And in general, Canadians have a positive attitude towards immigration and immigrants. Very different, for example, from our American neighbors or from the UK and so on. So immigration is what we're about as Canadians, and we should be doing it well. Most refugees have been through some incredible hardships before they got to Canada, and I can tell you that they continue to experience some pretty significant financial, psychological, and adjustment difficulties after they get here. There are, in fact, a number of things we could be doing better in terms of helping people to adjust to Canadian life and develop rewarding and productive lives for themselves and their families. But the thing we should be doing is going backwards and resulting in producing insecurity, people having to worry about, well, if my kid gets sick, will I be able to take them to a doctor? In the end, in my view, these cuts are mean-spirited, they're short-sighted, and they're just plain un-Canadian. And last but not least, well, maybe least, but anyway, last, any piddling amount that the federal government may save by these cuts is likely to be downloaded to the provincial system and Alberta taxpayers. So I'm hoping by having this meeting in front of the provincial legislature that we can raise awareness of Albertans that Alberta should be addressing these concerns with our federal government. Thanks.